Welcome back. In the chapter of health programs in India, in today's session we will discuss about National Urban Health Mission. The National Urban Health Mission is launched by the Ministry of Health and Family Welfare Department of India. So we see that the National Health Mission has two divisions: National Rural Health Mission and National Urban Health Mission, wherein we are going to discuss about the National Urban Health Mission. It was launched by the Ministry of Health and Family Welfare Department of India. It was launched in the year 2013 on 1st May. On 1st May in 2013. It seeks to improve the health status of the urban population. So the National Urban Health Mission, it seeks to improve the health of the urban population. Urban health, National Urban Health. So it is seeking to improve the health of the urban population, obviously. And the main focus in the urban population is on the slum dwellers and the vulnerable section by facilitating the access to the quality healthcare. They are focusing on the slum dwellers and also the vulnerable sections. The vulnerable sections, they are facilitating the access to the quality health care. They are providing an access to the quality health care, and the National Urban Health Mission covers all the states, capitals, districts, and headquarters. So we see it covers the states, capitals, and district headquarters. So this was about the introduction, and now we know that the National Health Mission, it encompasses two divisions: National Rural and National Urban. National Rural Health Mission, National Urban Health Mission, wherein in today's session we will discuss about Urban Health Mission. In the next session we will deal with Rural Health Mission. In the Urban Health Mission, it improves the health status of the urban population. The urban poor, those are the slum dwellers, and the poor people of the urban population, and also the vulnerable sections. The population coverage is more than 50,000. In urban, it is more than 50,000. Now, let us see in the Rural Health Mission, it is providing the quality health care to the rural population. You can see the Rural Health Mission provides the quality health care to the rural population. The vulnerable group is covering and also to the vulnerable group. It is providing the quality health care, focusing mainly on the vulnerable group of the rural population. The population coverage is less than 50,000. So let us see the hierarchy and the order of each level. How much is the coverage? To begin with, the Mahila Arogya Samiti, it covers about 50 to 100 slum households. It provides the mobilization support to the households. So you can see the Mahila Arogya Samiti. This is something very important we have to know. The Mahila Arogya Samiti, which we will discuss in detail in the upcoming slides. Remember, it is covering about 50 to 100. It is covering about 50 to 100 households. Ashas. One Asha, that is accredited social health activist, she will cover about 200 to 500 slum households. She is covering about 200 to 500 slum households. She facilitative support to the Mahila Arogya Samiti. Asha gives a facilitative support to the Mahila Arogya Samiti. Next we have one ANM, that is auxiliary nurse midwife, is allotted for about 10,000 population. It facilitates the support to the Asha. Auxiliary nurse midwife will support the Asha. Then we have the medical officer who is in charge at the urban primary health center, primary health care level, wherein he covers about 50,000 population, where he provides a facilitative support to the auxiliary nurse midwife. So I hope you're clear with the populations. Let us summarize again. The first thing was Mahila Arogya Samiti, which is covering about 50 to 100 households. Next we have Asha. Asha is covering 200 to 500. 200 to 500 households. Followed by the auxiliary nurse midwife covering about 10,000 population. 10,000 population. And then we have the medical officer who is in charge at the urban primary healthcare level, where he is covering about 50,000 population. And the medical officer provides a facilitative support to the auxiliary nurse midwife. Auxiliary nurse midwife provides a support to the ASHA worker, and ASHA will provide a facilitative support to the Mahila Arogya Samiti. I hope this is clear. Now let us begin with the National Urban Health Mission's main focus. So we have some idea that the main focus will be upon the vulnerable sections and the slum dwellers. So let us see the urban poor population living in listed and unlisted slums. So very important. The main focus is the uplifting the health access of the urban slum dwellers. It is focusing on the urban poor population, the poor population who are living in the listed as well as unlisted slums. Okay, you can just say the poor population who are residing in the listed as well as unlisted slums, recognized and unrecognized slums. All the vulnerable population, such as the homeless rag pickers. We know the homeless rag pickers. They go on the streets, they rag pick all the waste, and then so such people who have no homes. So the homeless rag pickers. The street children. So we know many children living on the streets. So the street children. Rickshaw pullers. Construction and bricks workers. So we know those laborers who do the construction and brick work. Sex workers and other temporary migrants. So we have some temporary migrants from the other areas, and such people who have temporarily migrated from the rural area to the urban area to earn, or for such people for their employment, and such people are the temporary migrants. We have to provide a quality health access to them. So we see the urban population is focusing on the homeless rag pickers, street children, rickshaw pullers, construction and bricks worker, sex worker and temporary migrants. The public health trust on sanitation, clean drinking water and vector control. So we see the focus is also on the public health trust, wherein we are focusing on the sanitation, provision of the clean drinking water and vector control measures. The main focus is also on strengthening the public health capacity of urban local bodies. So we see we are strengthening the public's health capacity by strengthening the local bodies. Now we move on to the services which are delivered under the urban health delivery system. It is through the urban PHCs and urban CHCs, urban primary healthcare centers and urban community healthcare centers. So we know the community healthcare centers will be at the districts level, where all the services are provided. The outreach services will be targeted to the target group. Again, the services at the PHCs, CHCs, the main target is to the slum dwellers and the vulnerable sections. The outreach services will be provided to the female health workers. So we see this service, the outreach services are provided for the female health worker. You can see the female health worker here. And essentially the auxiliary nurse midwives. Here the outreach services will be provided essentially by the auxiliary nurse midwives. So clear guys, how are we providing the services in the urban areas? By the urban PHC and the urban CHC. To whom is this service mainly focusing on? The slum dwellers and vulnerable group. Who is providing the service? Especially the female health workers, essentially the auxiliary nurse midwives. Now, what are the services? The essential services which are rendered by the ASHA. So we know the ASHA worker, that is the accredited social health activist. You can see it would promote a community health volunteer. We know it is promoting a community health volunteer. Who is a community health volunteer? ASHA, the full form of ASHA is accredited social health activities. We also have the link workers in the urban poor settlements. So in the slums we have this link workers or the ASHA workers, where one ASHA is for 1000 to 2000 urban poor population, covering about 200 to 500 households. So we have studied about it earlier. ASHA will be covering about 200 to 500 households of about 1k population. Okay, and then we studied that auxiliary nurse midwife will cover about 10k population and 10,000 population, and the medical officer about 50,000 population. And Mahila Arogya Samiti 50 to 100 households. So that was just a quick revision. For now, remember that the services are provided by the ASHA. The services are provided by the ASHA worker, or it is provided by the link workers. And the ASHA will be covering about 200 to 500 households, a population of about 1000 to 2500. Okay. It also ensures the participation by creation of community based institutions. So we have the active participation of the community. We see the community is also actively participating by establishing this Mahila Arogya Samiti. We will discuss about this in the upcoming slide. Remember, they are also encouraging the formation of the Mahila Arogya Samiti by the community's participation. The National Urban Health Mission will provide an annual grant of rupees 5,000 to Mahila Arogya Samitis every year. So, rupees 5,000 is granted to the Mahila Arogya Samitis annually by the government. Services to be rendered by the ASHA. So we see that the National Urban Health Mission is the main services are provided by this ASHA workers and the link workers. So let us see what are the essential services rendered by ASHA. A very a question which can appear in your examinations, wherein they will ask you to list out the functions. What are the functions of the ASHA workers in urban areas, or what are the functions of the services of the ASHA workers? The essential services are active promoter of good health practice. So she will be actively promoting the good health practices and enjoying the community support. She will be one and all in the community, and she is enjoying the community support. The Mahila Arogya Samiti will be there in her support. So we see that Mahila Arogya Samiti is providing a facilitative support to the ASHA. So she is promoting the good health and also enjoying the community support. Facilitating the awareness on the essential reproductive and child health care services, sexuality, gender equality. So, bringing on the awareness about the gender equality in the community, about the sexuality and RCH services. She is educating the people about the right age at marriage and the right age of pregnancy. So we see the right age to get married, and now it has come from 18 to in girls to 21, and it is equal for boys. 21 years is the right age for the marriage. So she will be educating the people to cut down the early marriages and pregnancy, to space the pregnancies. She will educate the people about the various contraceptive methods available, educating the people for the right age of the pregnancy. Motivation on the contraceptive adoption. So we see she is motivating the people to space the children, or if she has already acquired her desired family size, then she will ask them to undergo the sterilization procedures, wherein she will also get some incentives by the government. So the motivating the people for the contraceptive adoption and medical termination of pregnancy. So if there are some like complications, then she can educate the people of the availability of the medical termination of the pregnancy, safe MTP, rather than going for their homemade like techniques wherein they will land up into sepsis. So this ASHA worker will educate the people about the safe MTP, sterilization procedures, spacing methods, etc. And also the early registration of the pregnancy, so that the mother gets a complete ANC. She can visit, have the antenatal checkups and get the complete antenatal care, so that she can have a healthy baby and improve her health as well. So, the early registration of the pregnancies, the pregnancy care, and clean and safe delivery. If in case the people insist on having a domicile delivery, where they want to perform the delivery at home itself, then she has to educate the people about the clean as well as safe deliveries. Nutrition and care during pregnancy. She also focuses on the nutrition and care during pregnancy, where identification of the danger signs are done during pregnancy, and she will refer the patients to the nearest CHC or the medical hospital. So she also takes care about the danger signs during pregnancy and counseling on immunization, ANC and PNC. She is performing a counseling on how important the immunization is for the child and also for the pregnant mother, and focusing on the antenatal care and prenatal care for the women. So, guys, regarding the pregnancy, so we'll start from here. First thing is, you are telling them about the reproductive child healthcare services which are available, and then what are the right age for marriage. After the right age for marriage, then comes the pregnancy. After marriage, pregnancy, you can remember like this: marriage. She will educate the people about the right age for the marriage and pregnancy. Once the pregnancy occurs, then after the pregnancy everything is over, she is focusing on the contraception, sterilization, medical termination of pregnancy, spacing, etc. Then if this is not done, the contraception is not done, then the pregnancy, if the MTP is not done. Okay, let us see. If there was early marriage, if there was age of the marriage was too early, then she had to undergo MTP, something like that, you can remember. If in case the MTP was not possible, crossed 6 months, then early registration of pregnancy, she needs to get the pregnancy registered. The pregnancy care has to be taken, clean and safe delivery has to be performed. So these are the services which are provided by the ASHA. She will tell the people about the age of the marriage. She will educate them regarding the various spacing methods which are available, contraception methods, and then medical termination of pregnancy. And then if the pregnancy has occurred, early registration, the complete pregnancy care, safe and clean delivery. Followed by during delivery, she will also take care about the educating the people about the nutrition, wherein the calorie requirements will be altered. So she has to increase the uptake of the calories on daily basis. So all of that nutrition care will be provided during the pregnancy, and she will identify the danger signs and provide a counseling during about the immunization, ANC and PNC. Asha will act as a depot holder for the essential provision. She will also act as a depot holder for provision of ORS, oral rehydration therapy. And we have iron folic acid tablet. She is also providing this iron folic acid tablets. So we see ORS for the simple conditions like dehydration, iron folic acid tablets for anemia. We have chloroquine, oral pills, condoms, etc. Okay, for we have as a contraceptive methods, she'll also provide oral pills, condoms, etc. So the provision, she is a holder, the pot holder for the provision of ORS, iron folic acid tablets, chloroquine, oral pills, and condoms. Identification of the target beneficiaries and support the auxiliary nurse midwife. So she will also identify these target beneficiaries. Who are those target group? She will identify the target beneficiaries and also support the auxiliary nurse midwife in conducting the regular monthly outreach sessions and also tracking the service coverage. She will track the service coverage in this area. For instance, the services coverage have been completed about for this area. Then this ASHA worker will provide a facilitative support to the auxiliary nurse midwife by tracking the service coverage, how far the area has been covered. So she will track the surface coverage and also help the ANM in conducting the regular monthly outreach sessions. So the regular monthly outreach sessions, she will provide the support and also track the service coverage. Facilitates the access to the health related services which are available at the Anganwadi primary urban health centers, urban local bodies, and other services are being provided by the state and central government. So we see she will also facilitate the access to the health services. Again, we know the main function is to facilitate the access to the health services. The health services are available at the Anganwadi centers and the primary urban health centers. Primary urban primary health centers, and then we have urban local bodies, other services which are provided by the state and government of central government. Formation and promotion of the Mahila Arogya Samitis in her community. The service which is provided by Asha, or the role of Asha, is also to also to form and promote the Mahila Arogya Samiti in her community. So you can see the Mahila Arogya Samiti, which is formed and promoted by the Asha workers, and she needs to arrange escort, or she has to accompany the pregnant women and the children who are requiring treatment to the nearest. So at times she has to either arrange, or she has to accompany the pregnant women and also the children who are requiring the treatment to the nearest urban PHC or secondary tertiary level healthcare facilities. She has to accompany them. So you can see this Asha worker accompanying the children, or you can see the pregnant mother. If she's a second time pregnant, we'll take it as a second pregnancy. So this Asha worker will escort, or she'll accompany the pregnant women and the children who are requiring treatment to the nearest urban PHC, to the secondary or tertiary level healthcare facilities, which is nothing but the CHCs, medical hospitals, etc. Reinforcement of community action for immunization. So again, she is educating the people, reinforcing the community's action for immunization, and also for the prevention of waterborne and other communicable diseases like TB. The DOT strategy is followed. Directly observed treatment short course, and then the prevention of malaria. So this ASHA worker will promote the aerosol sprays, use of insecticide bed nets, insecticide treated those sheets and beds, and bed nets. So these things will be promoted by Asha. So she is focusing on preventing these communicable diseases like TB, malaria, chikungunya, and Japanese encephalitis, followed by the maintenance of necessary information and records about the birth and death, immunization, and antenatal services. You can see she is recording the important information, the necessary information about the birth. Okay, she is recording the information about the birth, death, in the community, about the ANC, antenatal care, what are the like how many checkups they have visited, and how many if the baby is there, what was the immunization status of the baby. And she'll also focus on the other unusual health problems or the disease outbreaks in the community. Okay, and then she will share the information with the auxiliary nurse midwife in that area, and also carrying out the preventive and promotive health activities with Anganwadi workers or Mahila Arogya Samiti. So she will also carry out the preventive and promotive activities. So the preventive and promotive activities are carried out along with the Anganwadi workers and Mahila Arogya Samiti. So these are the main activities or the services which are rendered by the Asha worker. So we'll see for every 50 to 100 households, that is 250 to 500 population, we have Mahila Arogya Samiti. It is very important. So again I have repeated this this figure wherein the urban healthcare facilities at each level is indicated. The 50 to 100 households, that is about 250 to 500 population, is the coverage of Mahila Arogya Samiti, and then the Asha worker or link worker will cover about 200 to 500 households, that is 1000 to 2500 population. And the outreach sessions 1 ANM, that is auxiliary nurse midwife, will cover about 10,000 population. The outreach sessions in any area of every auxiliary nurse midwife is conducted on a weekly basis. Next we have the urban PHC, wherein for every 50,000 population we have one urban PHC, and the urban CHC is for about 2.5 lakh population. And also we have these support staff, public health management. All this is not required in depth. You just remember the urban PHC is covering about 50,000 population. Then we have CHC at the district level. At the district level, CHC's inpatient facility 30 to 50 bedded, 100 bedded facility will be provided in metropolitan cities and cities with a population of about 5 lakhs. And it is covering about 2.5 lakh population, and 100 bedded facilities are provided for a population in metropolitan cities and which is having and each CHC will be allotted for about 5 lakh population. Okay. Urban Primary Health Center. So we see that the urban primary health center is functional for a population of around approximately 50,000 to 60,000. The urban primary health center will be located preferably within a slum. So obviously it will be located preferably within a slum or preferably near a slum within half a kilometer radius, so that it can cater a slum population of about 25,000 to 30,000 with a provision of OPD. So you can see here the picture. It is especially located near the slum areas within half a kilometer radius of a slum area, and it will provide the OPD. Okay, OPD service. What are the various services which are provided by the urban PHC? That is OPD consultation, basic lab diagnosis, drug contraceptive dispensing, drug as well as contraceptive dispensing. Apart from the distribution of these, we also have the distribution of health education materials and delivering the RCH services and counseling for all the communicable and non-communicable diseases. So we see that urban PHC services is, the first thing is OPD consultation and basic lab diagnosis like the basic blood test, and then drug and contraceptive dispensing. They will also provide the drugs, free drugs, and also the contraceptive dispensing. The distribution of health education material, They will also give this health education material, which is delivering the reproductive and child health services. They're also providing a counseling for all the communicable and non communicable diseases. Moving on to the referral unit, the urban primary health center, then we have the community health center. The urban CHC is the referral unit, which is set up as a satellite hospital for about 4 to 5 UPHCs. So, how can we understand that? So, imagine this is, okay, let us take this. Yeah, this is one urban PHC, the other urban PHC. So, we have about 4 to 5 urban PHCs, and for the 4 to 5 urban PHCs, we will have one urban CHC. This one urban CHC is set up for about, it is a satellite hospital for every 4 to 5 urban primary health centers. So, this is one PHC, urban PHC, urban PHC. For 4 to 5 PHCs, we have one urban CHC, community health center, which is a referral unit. Any cases which cannot be dealt in the primary health care level, they will transfer this cases from the primary health center to the urban community health center at a higher level, because the services which are available at the community health center will be different from that of the CHC. They will be more advanced and upgraded. It will also provide an inpatient service and would be a 30 to 50 bedded facility. In urban CHC, we have 30 to 50 bedded facilities. If it is a metropolitan city, then it is 100 bedded facility where the population is more than 5 lakhs. Moving on to the targets of the National Urban Health Mission. The main target is to reduce the infant mortality rate by 40% in the urban areas and achieve the universal immunization in all the urban areas. They intend to reduce the infant mortality rate by 40%. And the main target is reduce the maternal mortality rate by 50%. So you see, maternal, mother, maternal mortality, maternal deaths, okay, the rate of the maternal death should be brought down to 50%, to reduce it to 50%. Then we have infant mortality rate, we are reducing it to 40%, okay. Achieve the universal access to reproductive health, including 100% institutional delivery. We are achieving the universal access to reproductive health. The main target is the community should have an access to the reproductive health service and also access to the 100% institutional delivery. To achieve the replacement level fertility and the total fertility rate to be 2.1, and also to achieve all targets of disease control program. They need to achieve the targets of the disease control program, where they want to eradicate as also bring down the cases of the communicable and non-communicable diseases. We need to achieve the target of the disease control program. So what were the main targets? Maternal mortality reduced by 50%, infant mortality rate reduced by 40%, and total fertility rate to be brought to 2.1, universal access to reproductive health and also providing 100% institutional delivery services, and achieve the targets of the disease control program. Thank you. With this, we come to an end of the urban primary health center as also the referral units. The urban health mission is done. In the next video, we will discuss about the national rural health mission.